Obsessive-compulsive disorder, or OCD, is a serious mental health condition. It affects millions of people around the world. OCD is characterized by recurring unwanted thoughts, images, or urges. These are called obsessions. They cause significant anxiety and distress. To cope with these obsessions, individuals with OCD engage in repetitive behaviors or mental acts. These are called compulsions. Compulsions provide temporary relief from the anxiety caused by obsessions. However, this relief is short-lived. The obsessions inevitably return. This leads to a vicious cycle of obsessions and compulsions. OCD can significantly impact daily life. It affects work, school, relationships, and overall well-being. It is important to remember that OCD is a treatable condition. With proper diagnosis and treatment, individuals with OCD can manage their symptoms and live fulfilling lives. Obsessions and compulsions are the hallmarks of OCD. They are the defining characteristics that make this condition so challenging for those who experience it. Obsessions are intrusive and unwanted thoughts, images, or urges that can be incredibly distressing. These thoughts are not just fleeting worries, they are persistent and often cause significant anxiety. They repeatedly enter a person's mind, making it difficult to focus on anything else. Common obsessions include fear of contamination or germs, which can lead to excessive cleaning and avoidance of certain places or objects. Fear of harming oneself or others, which can result in constant checking and reassurance-seeking behaviors. Need for symmetry and order, where everything must be arranged in a specific way to feel just right. Other obsessions include unwanted sexual thoughts and religious obsessions, which can be particularly distressing. Compulsions are repetitive behaviors or mental acts that people with OCD feel driven to perform. These actions are attempts to reduce the anxiety caused by their obsessions. People with OCD perform them to reduce the anxiety caused by their obsessions. Common compulsions include excessive washing or cleaning, which can lead to raw, chapped skin and significant time spent on these activities. Checking behaviors like repeatedly checking locks, stoves, or other items to ensure they are secure. Counting and arranging objects in a specific order, and repeating words or phrases to prevent something bad from happening. And mental rituals such as silently repeating a prayer or phrase to ward off danger or distress. These obsessions and compulsions can consume a significant amount of time and energy, often leaving the person feeling exhausted and overwhelmed. This interferes with daily activities and relationships, making it difficult to maintain a normal routine or connect with loved ones. It is important to note that everyone experiences intrusive thoughts from time to time. However, for those with OCD, these thoughts are persistent, distressing, and difficult to control. The thoughts and behaviors associated with OCD are not just minor annoyances, they can be debilitating and require professional treatment to manage effectively. Cognitive behavioral therapy, or CBT, is a highly effective treatment for OCD. It is a structured, time-limited therapy that aims to change patterns of thinking or behavior that are causing people's problems, and thereby change the way they feel. CBT is based on the concept that thoughts, feelings, physical sensations, and actions are interconnected, and that negative thoughts and feelings can trap you in a vicious cycle. It is often considered the first-line treatment option for OCD because of its strong evidence base and effectiveness. CBT can be delivered in individual or group sessions, and it can also be adapted for self-help programs. CBT helps individuals identify and change negative thought patterns and behaviors that contribute to their OCD. By working with a therapist, patients learn to challenge and alter their unhelpful thoughts and develop healthier ways of thinking and behaving. Exposure and response prevention, or ERP, is a specific type of CBT that is particularly effective for OCD. ERP focuses on exposing individuals to the thoughts, images, objects, and situations that make them anxious and/or start their obsessions. ERP involves gradually exposing individuals to their feared situations or objects, while preventing them from engaging in their usual compulsions. This process helps them learn that their anxiety will decrease naturally over time, without the need to perform compulsive behaviors. For example, a person with a fear of contamination might be asked to touch a doorknob without immediately washing their hands. Over time, they learn that the anxiety they feel will lessen without the need for their compulsive washing. Through repeated exposure and response prevention, individuals with OCD learn that their anxiety will naturally decrease over time without the need for compulsions. This helps them build confidence in their ability to manage their anxiety and reduces the power of their obsessions. CBT and ERP are typically conducted by trained mental health professionals. These therapists are skilled in guiding patients through the process and providing the support and encouragement needed to make meaningful progress. These therapies empower individuals to manage their OCD symptoms and regain control over their lives. By learning to face their fears and change their thought patterns, patients can achieve a significant reduction in their symptoms and improve their overall quality of life. In addition to therapy, medications are often used to treat OCD. These medications can help manage the symptoms and improve the quality of life for those affected by this condition. Selective serotonin reuptake inhibitors, or SSRIs, are the most commonly prescribed medications for OCD. They have been proven effective in reducing the intensity of obsessive-compulsive symptoms. SSRIs work by increasing levels of serotonin in the brain. Serotonin is a key neurotransmitter that influences mood, anxiety, and overall mental health. Serotonin is a neurotransmitter that plays a role in regulating mood, anxiety, and obsessions and compulsions. By enhancing serotonin levels, SSRIs help alleviate the symptoms of OCD. Commonly prescribed SSRIs for OCD include fluoxetine, also known as Prozac, sertraline, known as Zoloft, paroxetine, known as Paxil, and escitalopram, known as Lexapro. Another frequently prescribed SSRI is citalopram, known as Celexa. Each of these medications works in a similar way but may have different effects on different individuals. It is important to note that SSRIs can take several weeks to start working. Patience and consistency are key when beginning a new medication regimen. It is also essential to follow a doctor's instructions and take the medication as prescribed. Skipping doses or stopping medication abruptly can lead to a relapse of symptoms. Side effects of SSRIs can occur, but are usually mild and temporary. Common side effects include nausea, headache, and insomnia. These side effects may include nausea, which can often be managed by taking the medication with food. Other side effects like headache and insomnia may also occur, but they typically diminish as the body adjusts to the medication. Always consult with a healthcare provider if side effects persist or become bothersome. For individuals with severe OCD who have not responded adequately to traditional treatments, advanced treatment options are available. Ketamine, a medication originally used as an anesthetic, has shown promise in rapidly reducing OCD symptoms. Deep brain stimulation, or DBS, is a surgical procedure that involves implanting electrodes in specific areas of the brain. These electrodes send electrical impulses to regulate brain activity. DBS has been found to be effective in treating severe treatment-resistant OCD. Transcranial magnetic stimulation, or TMS, is a non-invasive procedure that uses magnetic fields to stimulate nerve cells in the brain. TMS has also shown potential in reducing OCD symptoms. These advanced treatments offer hope for individuals who have not found relief through traditional therapies. In addition to traditional and advanced treatments, complementary therapies can play a role in managing OCD symptoms. Mindfulness-based practices such as meditation and yoga can help individuals become more aware of their thoughts and feelings without judgment. This increased awareness can help individuals observe their obsessions and compulsions without engaging in them. Stress management techniques, such as deep breathing exercises and progressive muscle relaxation, can help reduce overall anxiety levels. This can make it easier to cope with OCD triggers. While complementary therapies should not replace traditional treatments, they can be valuable tools for managing OCD and improving overall well-being. OCD can affect people of all ages, including children and adolescents. When treating children with OCD, it is important to involve parents or caregivers in the treatment process. Family-based therapy can help parents understand OCD and learn how to support their child's treatment. Pregnancy can also present unique challenges for women with OCD. Hormonal changes during pregnancy can sometimes worsen OCD symptoms. It is essential for pregnant women with OCD to work closely with their healthcare providers to manage their conditions safely and effectively. The risks and benefits of medication use during pregnancy should be carefully considered. If you suspect that you or someone you love may have OCD, it is crucial to seek professional help. A qualified mental health professional can make an accurate diagnosis. They can recommend an appropriate treatment plan. Early diagnosis and treatment are essential for improving outcomes and preventing OCD from significantly impacting an individual's life. Once treatment begins, Regular follow-up appointments are crucial for monitoring progress, adjusting treatment plans as needed, and addressing any challenges or concerns that arise. It is important to remember that OCD is a chronic condition. It often requires ongoing management. However, with the right support and treatment, individuals with OCD can live full and meaningful lives. Living with OCD can be challenging, but it is important to remember that you are not alone. Many resources and support systems are available to help individuals with OCD and their loved ones. If you are struggling with OCD, please reach out for help. Talk to your doctor, a mental health professional, or a trusted friend or family member. There is hope, and with the right treatment and support, you can overcome the challenges of OCD and live a fulfilling life. Please like and subscribe to our channel for more informative content on mental health and wellness.